Maddur? Okay. He works at 9 Circles with the Living Well with HIV workshops. So, Tari, you have 10 minutes starting now.
In a moment, I'm sharing my screen. Should be here. Hope you can all see my screen here.
Yep, it looks good, Sri.
Your microphone. Oh, I can't see anybody's screen.
You can?
We can see your screen, Sri. You're good.
Yeah, excellent. Give me a moment. Give me a moment. I'm going to another view. I should be good here. So yeah, very good morning. I will be talking to you about a workshop series that was developed here at 9 Circles. And these are the wonderful people that worked with me in developing this module as well as implementing this module, and some of them are here today. So I'm glad that they're here. So I know I've got 10 minutes. I'm going to rush through as quickly as possible. I know Ken is going to be after me. So my name is Srinath. I'm a health educator here at 9 Circles. Before starting, I would like to begin by thanking the HIV community here in Manitoba for contributing successfully for the development of this Standing Strong series. Thank you to the Public Health Agency of Canada, the Manitoba HIV Program, our partner agencies, the HIV Healthcare Specialists, Director of Prevention, Testing and Wellness, my fellow health educators, Research Evaluation Coordinator here at 9 Circles, Joel and Marge, who've been wonderful facilitators along with me, and Katie. It is through a common goal of improving the quality of life and well-being for Manitobans living with HIV that the Standing Strong series got developed. Thank you to everyone for being with us on that journey. I would also like to do a land acknowledgement. It is an honor to be here. I would like to begin my presentation by noting that I am a settler on the original lands of Anishinaabe, Cree, Oji-Cree, Assiniboine, Dakota, and Dene people, and on the homeland of the Métis Nation. We want to acknowledge the treaties that were made on these territories, the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. Standing Strong is a workshop series, and it focuses on well-being. That's basically quality of life and transmission prevention among people living with HIV here in Manitoba. It's very Manitoba-specific module. It also tries to address the needs of their family and friends as well. It is designed and developed in consultation with the community from the scratch, including those who are living with being long-term survivors, as well as newly diagnosed, as well as including their own support persons, that would be family members. It provides some of the basic information on several topics like HIV, CD4, viral load, discusses several prevention tools, and goes on to also discuss disclosure and stigma. The module is suitable for clients seeking some basic information on these topics. It is also a platform for those who would just like to meet each other and kind of share and collaborate and share their experiences. And each of these modules, there are four of these modules, which I will be talking in detail a little later. So it runs for about 90 minutes. I would like to kind of take you through a journey of this whole development process. Our aim was to look at the module, look for a module which focuses on well-being and transmission prevention among people who live with HIV here in Manitoba. So we did an extensive review of literature, review of existing modules, and found the Positive Self-Management Program, which was developed by the Stanford University, and it focuses on self-management management of HIV. So we delivered that program, we piloted it, and then also went on to listen to people about their experiences of this program itself. Well, they did appreciate the program, but also said that it's not very Manitoba specific. There are many needs that needs to be met here. Some of them could They also mentioned that disclosure is not really discussed in the module, which is a huge challenge for people living with HIV. And opportunity to parent after becoming a positive person. How do you have family? That's not discussed in the module. So they really wanted a very specific module which addresses these needs. And also very clearly they mentioned that it needs to be a shorter version because positive self-management program was for 6 weeks. And they really, it was difficult for people to kind of be on that for that long time. So we got back and then started to kind of develop the module. We took about a year plus to kind of research and develop some of the tools of best practices in delivering some of the health information to some of the adult learners, and also design this program. Well, while we were doing this, we had a consistent loop with the participants throughout the development of the 4-part workshop series. So the new workshop series then came to be known as Standing Strong. The name also was contributed by the community itself. They wanted this name to go there as a module. And then the module started to be delivered individually. We piloted this module as well and did a focus group to see if there's any changes that needs to be made. And based on that, each of the modules were finalized. Then we went on to kind of launch this module, and then we rolled it out to the beneficiaries, including those who are, the participants were those who were newly diagnosed, also long-term survivors, including family and friends. So this program was open to family and friends as well. But again, COVID hit and we could not go further on this just because there were so many of those restrictions. And the scale up has been a little difficult. Just because of the COVID thing. So we're back now, we are slowly starting to offer these programs to more people. So we've done about 16 workshops so far, but we've received brilliant feedback. Meanwhile, we also did train peers to co-facilitate these trainings and also trained people from other regions to also do this training, not just the peers. So and that would be the Brandon, the Prairie Mountain Health Region as well. Scaling up was difficult, so I'll talk to you about that. We came up with a little bit of a change plan for doing that. So this Standing Strong workshop series looks at all the components of knowledge, skills, and attitudes. And each of these workshops, as shown here, addresses different aspects of living with HIV. And each of these facilitator guides, there are 4 of them, are easy to follow with instructions clearly written out and facilitation tips, suggested readings, and is prepared for even those with little knowledge about HIV as well. The information presented is fairly basic, and there are suggested participant resources that can be ordered from several resource centers, including Katie. Many activities encourage management by brainstorming ideas and solutions and how to access these resources for more information. And participants can actually attend any of the modules in any order they want. They don't need to do it sequentially. So within the module, it's pretty engaging. It's just not a lecture mode. There's a lot of brainstorms. There's a lot of simulation activities. There's so much of group work there. And also in one of the activities, which I kind of shown you here, is a prevention toolbox, which comes out of a lot of discussion. And then people get to know there are different options for people living with HIV in terms of ensuring that the transmission doesn't happen. So it's a brilliant toolbox, and that also came out through those interactions with the community itself. And as I mentioned, we have done about 16 workshops so far. We initially thought that we'll be doing something like 30 plus, but we weren't able to just because of the COVID pandemic. And we've done a training of trainers workshop. We've trained peers as well as healthcare providers from the Prairie Mountain Health Region, and including people here in Winnipeg. Peers, we kind of asked the community who attended this training program about their feedback, and everyone felt having a peer facilitator in the training has been highly valuable. They've kind of said that makes a lot of sense. And long-term impact of in terms of treatment adherence or other quality of life measures, we still are not there. We would like to do that a little later. So that's coming soon. These are some of the quotes from people who attended the workshop. They felt happy to be there. They felt it was a social learning space. There's one which says, I'm always comfortable to be with the group like here today to discuss about the same issues that we are all struggling with. So there's a lot of cohesion. There's a lot of feeling of togetherness there. There's some cultural safety also that's also there. We also integrated that as part of our training as well. Our challenges have definitely been COVID pandemic restrictions. So during this time, what we did was we came up with another plan of offering a low-key effort, more like a virtual effort, where we show a movie online, people join in online, and we send them over dinner. It happens over dinner, and then it's a short movie on a theme.
You have about a minute and a half.
Brilliant, thank you. And it's based on the theme of Standing Strong itself. So people watch this and they kind of, we do the same breakout rooms that we do here, and then have them do a poll and interact with them. So this has been received very well. It's fun for the participants, also for the facilitators as well. And we have facilitated dinner and a movie along with the branding team, as well as the peers as well. So we've all enjoyed this, having this program. So one of the things is the downfalls of this is that not many people have access to technology and internet. So that has been a little downfall here. So because of which we'll see not many numbers being part of this. So some of the innovations have been engagement of people living with HIV in the development right through from the scratch, and also implementation. And I think very importantly, we should also include them in monitoring this programs as well. And the peer facilitation of Standing Strong and Dinner and Movie has come out really well. And the virtual adaptation of Standing Strong that during the COVID crisis. So that was received very well. So that's an innovation for us. And it's a huge lesson learned that we could do something like that. And participants are encouraged to bring their partners into the program. So which is also being received really well. And families have found that they've learned more being part of this program itself. And both newly diagnosed and longer established clients have found this workshop mutually beneficial. They've thought that there's so much of learning that each one of them could share and learn from each other. So there is significant opportunities for this kind of learning, the social learning, learning from each other, problem solving that happens from people who have been longer established clients sharing their own experiences, and the newly diagnosed clients saying that that's a helpful tip for me. And even including disclosure tips that happen during those workshops. So, and also handling stigma and kind of accessing some of the supports right here in Winnipeg or other locations as well. So yeah, these are basically some of the things that I really want to share. So I hope I'm on time. I'm done.
Thank you, Sri.
Thank you, Sri. Ken, I apologize. I muted you, so you'll have to unmute yourself. I panicked. I muted you.
There we go. Next up on this panel is working with newcomers communities in Winnipeg towards preventing and reducing HIV stigma. And that's Simret Daniel and Anna Lervolino, I guess. I'm sorry if I'm pronouncing it wrong. And you guys are up.
I see Simret and Anna there. Hi, guys.
Yeah, so should we start?
Yes.
Yes.
Yes,
Oh, thank
absolutely.
you.
Yeah.
Yeah, thank you. Really appreciate. Thank you, Ken, and thank you, everybody, for coming to this presentation, for being here. My name is Simret Daniel. I work at SERC, Sexuality Education Resource Center. Today, I am going to present regarding key knowledge into action project, one of the projects I shared with my colleague Anna. So key knowledge into action project is one of SERC's project as SERC, which is funded by PHAC, Public Health Agency of Canada. And the main component of the work is working to provide workshops to communities, youth, community leaders, community resource people, and multicultural leaders and service providers. The objective of the project is to increase knowledge on HIV and STBBIs and uptake of safer behavior among community members, to increase capacity of leadership in working with communities toward HIV prevention, treatment, testing, and stigma reduction. Also to increase capacity of service providers in working with newcomer communities to provide services. To do that, I want to mention also how our approaches are in working in this project. We collaborate with cultural communities and organizations and key individuals also in the community, with local and national service providers in the academia. And as you know, SERC is a community-based organization, so our approach is also a community-based approach. We try to create a culturally safe environment and trauma-sensitive environment as much as we can. Try to create safer environment. When we work with community, every step, from planning, setting up the workshop, implementation of the activities or the deliverables, and evaluation, every step includes community involvement or community engagement. In all the steps, we have community allies. And we set up, for example, we set up our workshops in discussion with communities and community resource people in a way that respects their values and that considers their availabilities. For example, we set up our sessions either before or after Ramadan fasting for communities who fast and cannot discuss sexuality or sexual and reproductive health topics during the fasting months, or sometimes even some of our sessions has to be maybe gender specific groups, or for some also they might prefer mixed groups. So we go according to the advice of the community. And also community leaders and the key community people, the trusted community people are most of the time they are the advisors and the recruiters of our workshop, and part of also our evaluation focus groups and and also in our follow-up with the communities after our sessions also, they are the key people always, because during and after our workshops always we receive lots of consultations, and we need also language for that communication to happen smoothly and to communicate in a culturally sensitive or responsive approach. Always we depend on the community resource people. So when I and Anna are presenting, we always we want you also to see behind us, the community resource people work is the one that really gives success to our project. So I really want to appreciate their contribution in everywhere we go. And we talk about our projects. And like when we pick the day of the workshops, like always we try to communicate with community resource people or the key community people, like to know like if there are other cultural events or workshops or like how is the work or school or other factors that affect our events. Even sometimes we have to reschedule it because of like rapid changing circumstances in the communities, because maybe if there is a community funeral, we have to respect that, because like we don't do a session for the sake of doing it, but we want to do it with the community for the community. And we try to create also a welcoming environment by providing traditional meals, most of the time prepared by community caterers, which has a lot of meaning in a community as well. Like when we have in-person sessions, and our workshops are facilitated most of the time either in first language or with interpretation, if it is in English or French. And when we are addressing HIV always and STBI, always like we try to also to see the health determinants, like the social health determinants that affect also like as we work also like with newcomer communities from like the project works with newcomer communities from African origin. So as we work with newcomer communities from African origin, always we have to address the social determinants of health, because without addressing the social determinants of health, like we cannot talk about HIV or STBIs, like and also stigma is also a big issue. We have to address stigma, like the systemic, or it can be also that comes it also within the community because of lack of information. So like we at the same time also we try to share also with service providers also what we hear from the communities as well, because stigma has to be addressed also in a system that like it comes from the system, so like has to be addressed also in a systemic way as well. So and yeah, like different social and systemic racism issues also comes up in our workshops as well. Criminalization is a big issue, like and like for some communities also, they were affected not only by the criminalization, but to the extent of deportation as well. So like it really affects also our communication, the trust building with a community. It sometimes it slows down really really strongly affects our relationship. Like sometimes we have to go go back again and again and again and again, because that trust is really hurt. So to work together, we have to rebuild that trust again and again. So it really affects, like this criminalization and disclosure issues really affects also our work, the HIV criminalization. And always also when we talk about testing and treatment also, access also like access to services also comes up. Discussion of access to service also comes up. It can be to social services or health services. Anna might mention also like some of the evaluation outcomes that she hears even like after our workshops from the participants. So Anna, I will leave the stage for you. Okay. What did this?
You only have about a minute left.
Oh, yeah, okay, yeah. Anna, please go ahead. Yeah.
How much, Ken? Sorry?
1 minute.
Okay. So I will just give a brief highlight. My name is Lervolino. I am a Program Evaluation and Research Coordinator at SERC. And we invite participants to complete evaluation forms, and we also have focus groups after a follow-up, like after some months. So from the tests that we, for community, with the sessions that are aiming to increase knowledge, we have knowledge tests in which participants respond true, false, or I don't know to each questions. And what we see there, the main finding is that there is a big disparity. Some people already have 100% correct in the first before the sessions, and many don't. But we see different levels of exposure to scientific evidence. But what we can see in terms of average is, on average, 35% of correct answers at the beginning and 93% at the end, which means a big decrease in the gap, and it's something that I can share. I would have many quotes to share also about how the information on stigma have been applied back in the communities, and quotes that I get from the focus group. We can leave that for another opportunity. If anybody is interested, please connect with me. I can leave my email here in the chat box. And thank you so much for having us. We are super excited to be here.
Thank you very much, Simret and Anna. We really appreciate your presentation. Give a chance to do just a quick round of applause, and then we'll
Thank
move on.
you.
So next up is Colleen Tower, and she's talking about how lockers increase access.
Hi, so I'll introduce myself. I'm Colleen Tower. I am a community health developer here in Flin, Flon, and I have a bit of a focus on harm reduction. And while I set up the screen, I'll let Mike.
My name is Michael Clark. I'm here as a peer, and we're coming to you from Treaty 5, traditionally Cree and Dene territory.
So, here we go. So I'm going to give just a quick little rundown of how we started this locker program, and then Mike's going to kind of fill in some of the gaps for me. So in the spring summerish of 2019, Public Health Agency of Canada gave us some money to start a project with a peer group to collect some data and then implement some of the actions from the data that came out. So we had a partnership with the Northern Health Region, Manitoba Harm Reduction Network, and then the peer group was formed. So that was about 10 to 12 people at times. In the first phase, though, there was probably 40 to 50 people, I would say. Yeah, about 40 to 50 people participated in the first phase of data collection. Once that group was formed, we had meetings throughout the spring and summer, a little bit into the fall. There was 5 priority actions that were addressed throughout that group. And today we're going to talk about better access to supplies. The priority actions were amazing, and we did a lot of work on all of them, even when some of them didn't actually come to fruition. There was a lot of good conversation, but today we're going to talk about how we addressed better access to supplies.
Okay, so we came up with a list of things that we wanted to address, and what we found was that there is barriers for some, like the legality of a safe consumption site is something that we couldn't necessarily address, but we were able to move forward on certain things. We found that access to supplies was a major one. Partially because people were having trouble accessing the emergency at the hospital here in town, just because of attitudes, because of stigma, because people didn't want to deal with people accessing there for safe supplies. So we were doing a lot of peer-to-peer distribution. Just not everyone wanted to access this building. Not everyone feels comfortable coming in. And then also just this keeps regular hours. So it's not a 24-hour place to pick up supplies. So we were brainstorming. We came up with a lot of ideas, and out of them, what seemed most plausible was coming up with mailboxes. So there's actually Colleen who put that all together. At first, we talked about a vending machine. We even talked about a van to deliver supplies, and just our low-tech answer was mailboxes.
Or yeah, we call them and lockers or whatever.
Lockers.
So they, and really, the group really rallied, but like, and Mike was part of the group. I don't know if we were really clear about that. Mike was really an integral part of the group. The group really gelled and had great ideas and like really put it out there. So like these lists on the screen here were all kind of the reasons we sort of came up with as a group that the lockers would work for us. Like we live in a freezing country, and we just didn't know if electronics would hold up well out there with vending machines. I really want to highlight though, because I think this will speak to some of the other stuff, is that the lockers are super inconspicuous, and the peers were very, very clear that what they wanted was something that nobody else needed to know unless they felt they needed to know what was in that locker. And that was a safety factor, I think.
Yeah, and safety, and then just also peers having issues with stigma. Like a lot of them didn't want to access this building, and we actually ended up putting the lockers here, but no one knows what they are. They're completely anonymous, and all anyone has to do is access this building once to set up a locker, and from that point in time, they only need to access again if they want to make a change.
Yeah, absolutely. So. Just a few highlights. I've been just over the past, we're coming up on 2 years now. So over the past 2 years, I've kind of been maintaining them with the help. Mike helps me out tons. He comes in and helps me once a month. So the lockers get restocked twice a week. The supplies are there and ready when people need them. You don't have to do a 8:30 to 4:30 kind of day. You can come and get it whenever it's convenient for you. We put sharps containers in the lockers for people who want sharps containers.
Some peers are doing peer-to-peer distribution through the lockers, so they're picking up supplies, not just for them, but for other peers within the community as well. I enjoy coming here once a month to put together supplies. It gives me something to look forward to getting out of the house. And what we've noticed here just within so I work out of a primary healthcare center. We've noticed, because I leave little notebooks in them, and so people leave me notes about questions they have, and that it's really started to build some connections with service providers just in this building, because I go and say, and the lockers are anonymous. I don't know whose locker is whose. So if somebody leaves a note, I'm just going to ask the proper person the response, and I write it down and leave a note for them too. And sometimes that helps people come through the door if they have further questions. And it was the peers that put together the education materials that come with this supply. So there's been a lot of indirect communication among peers that way. And that was something that we enjoyed doing, with all the research for that.
Yeah, and every single kit that's Mike helps me make gets an education insert in it, and they're different. There's about 6 or 7 different ones, right?
Yeah, and just almost like small little cards or pamphlets.
So in almost 2 years, and I was just kind of going through the numbers. So what's really interesting is that the lockers got up and running in 2020, right when the pandemic was starting. So the lockers, almost all of them were being used. All the accessible lockers were being used not too long after we got them up and functional. And this is kind of showing numbers in 2020 of what we were handing out. The numbers look like they've dropped a little bit this year, and I really credit that to people being more comfortable going to other services. And like Mike was saying about the emergency department, when we were having the peer group meetings, the peers were very clear that emergency didn't feel like a safe place to go to get supplies at that time. And so we advocated to the RHA to make emergency a more accessible place. And now I go weekly and take the emergency department supplies because they are handing out quite a bit. So that's been helpful too, and really increased access to supplies. We're trying to eliminate all the barriers so that people are getting fresh supplies whenever they need them. So do you want to talk about this? This kind of fits with the STBI, HIV, STBI prevention. Just with having, like, the more we know, the more we give out brand new supplies to people, the more we're promoting prevention. It's like Mike said, it supports peer-to-peer distribution. And that was really key in this, is that the peers really want to be helpful to each other. And this was a great way to do it. Some people, I stuff their lockers right full, and every week they're helping their friends out with supplies. It's been a great opportunity to also put in other little supply kits when we have the availability. The Play It Safer Network, which is a community kind of group here, every once in a while makes up these personal item kits with razors and nail clippers, toothbrushes, lip balm, stuff like that. And those go in the lockers for people to take. We do a lot of messaging that way. There's an upcoming event, so peers here, their peer group here is planning testing events. We can promote that through the lockers also. It's just a really low barrier way to try to get some messaging out while we're also supplying.
The idea is that harm reduction supplies saves lives, so we need it to be with as little condition as possible. So if people are uncomfortable even just coming in and asking for safe supplies, this is a workaround to that.
Yeah. And so finally, what we've learned, we've had a lot of interest from all over Canada with questions about, like, how is this working for you, and what would you do different? So we live in an area with a ton of snow for many, many months. So what I've learned is that you got to have somebody.
1 minute.
Oh, thanks. You got to have somebody who's on top of that snow removal. The lockers we have keys, and that's a blessing and a curse sometimes, I guess. Like, the keys are easy to replace when they get lost, but sometimes the keys make life more difficult. I have a whole list of reasons why I love or hate the keys on different days. Keeping up with having supplies ready to go, and this is where Mike really comes in integral. We have to, what did we make the other day? 170 kits just to be ready for the next 3 or 4 weeks. So we have to stay on top of that, because we're also making enough supplies for the primary healthcare center, for the hospital, for the lockers. So just to stay on top of that. Yeah, that's our beep, and then that's kind of it. It's been a really good program.
Thank you very, very much, Colleen and Mike.